Are you confused about the best way to optimize your bone health? Well, stick around because we're going to talk about our 4R bone optimization method. This is a framework that we have defined to help people to understand how to either work with us and optimize bone health or to do it on their own. So I'm going to go through the framework. I'm going to talk about the case of one of our patients who we just got some imaging on at the 12-month mark, and it's really exciting. I want to share it with you. So stick around. We're going to go through all this stuff, and it shouldn't take more than just a couple minutes. All right, so what you can see here is actually a screenshot from our website. So this defines the 4 R's. The 4 R's are this. We want to recognize why we're losing bone. We want to reverse those causes of bone loss, retest to make sure we're headed in the right direction, and revive your life so that you can live without the fear of fracture. I like that last one the best. So let's talk about the first one. We want to recognize why we're losing bone. I don't think that we should accept that bone loss is always going to happen for all of us as we age. Maybe a little bit, but for the most part, if we have good quality bone to begin with and we take care of ourselves as we age, osteoporosis should not be a problem. It is a totally preventable, avoidable thing. So if you have it, or if you are on your way to having it because you're rapidly losing bone, you need to know, why am I rapidly losing bone? You got to figure that out. There is a very long list of potential causes, all the way from different drugs that you might be taking, hormone dysfunction, menopause, andropause, gut dysfunction, nutrient depletion, diet issues. The list is not endless, but it's long. But you can go through that list and you can figure out, oh, that's me, that's me, that's me. And a lot of these things you can do something about. Some things you can't, like genetics, you're not going to fix that. But some things you can do, most things you can do something about. So once you identify those things, whether it be through blood testing or functional testing, then you have to, the second R, reverse those causes of bone loss. Okay. So we got to figure out what it is. We got to put a comprehensive plan in place so that we can reverse those causes of bone loss. As you're doing that, then you need to do the third R. The third R is to retest and make sure you're headed in the right direction, because that comprehensive plan does you no good if you don't know that it's working. And let me just take a moment too to talk about the framework that we use for that. We actually use the framework coming from our health optimization practice, Optimal Human Health MD, and we call this the optimization pyramid. It starts with foundational things, the foundational pillars of health: sleep, exercise, nutrition, and connection. Without those 4 things, none of the other stuff matters. Then we use targeted supplementation. We use hormones if they're indicated, peptides if they're indicated, and we have the option to do drugs as a physician-led program, but we don't usually. But that's the kind of framework that you need. All right. So then you create that thing and then you retest, make sure you're headed in the right direction. And it's okay if it's not. It's okay if it's not perfect, because we retest so that we can then course correct and keep going. The fastest way from one point to another is a straight line, but that is not the way that medicine typically works. We got to do a thing, retest, recalibrate, do a thing, retest, recalibrate. Without the retest, we are going to just blindly be headed in a direction, and you don't know that it's working until potentially it's too late. And then the 4th R is obviously what our goal is. This is our aim, is that we want to revive our life and live without the fear of fracture. And that sounds so amazing to me. So let me tell you about one of my favorite patients. I think I say that a lot. I have a lot of favorite patients, but this guy, his name is Tom. So Tom is awesome. He is he's a very motivated guy. He's 61 years old. He's a retired attorney. So right there, you actually can see that one of his stressors was probably stress. One of his causes of bone loss was probably cortisol, but he's retired. So he's on the other side of that. So that's great. We also went down this journey with him of figuring out, okay, why are you losing bone? He was surprised that he had osteoporosis, like shocked. He was like, why? Like, I'm a fit guy, kind of fit. I'm a fit guy. You know, I've been working out my whole life. I eat a clean diet. Like, why? So here's some things. So for him, he had recently lost weight, which, you know, weight loss is actually a risk factor for osteoporosis, but he didn't develop osteoporosis from that. I think it just pushed him over the edge. He was also on a proton pump inhibitor. So this is a over-the-counter drug that many people take for acid reflux, and it will inhibit your secretion of acid in your stomach, which will prevent you from breaking down protein and will prevent you from being anabolic and building muscle and bone. So that's a thing. Also prevents calcium and vitamin D absorption. Topic for another day. So he had some gut dysfunction because he needed a PPI. So that those are obvious related. He had low testosterone, not terribly low, but lowish. And he was also very much into doing a lot of exercise. So what I would call chronic cardio, which is, higher than zone 2 or zone 3, 4, the 140s, 50s, 60s kind of heart rate, and for longish periods of time, which wasn't serving him. He was still overweight. He had a lot of inflammation, and the cardio was just actually making it worse. And we also, through his diet, recognized he had some nutrient deficiencies. We did some testing and identified that. So for him, there were some little things that added up to ultimately being a big problem. So before we get to what we did and how we tested him, let me just make a mention too that the way that he found us was through YouTube. So if you could do me a huge favor, if you could subscribe to the channel if you're not already, that helps other people searching for osteoporosis content to find our channel. And also, if you haven't been to our free masterclass, strongly recommend that as a starting point, because this is where we talk about all of the different things that we're putting together on this channel in one place and offer an opportunity to ask questions. Last time we just did one last week. No, that was this week. We did one this week. And we had over 1,500 people register. And so many questions, and we only had about 15 minutes of questions, but it was a really, really good talk. So if you haven't done that yet, you should do that. Okay, so what about Tom and how we tested? Well, we did blood tests. So we do blood tests on everybody as part of our program, and we have an extensive panel that looks at adrenal function, thyroid function, nutrient deficiencies, hormones, a little bit of gut, and kind of on and on and on. It's a fantastic panel through the lens of health span. So we're also looking at dementia and cardiovascular risk factors. That's on our website if you want to look at it. For him, we also did a genetics test, which was really compelling, told us some really interesting things that we had to watch out for. And then also a stool test, because we wanted to look at his gut function, and we do that for pretty much anybody that is on a PPI. And so we moved forward with our treatment program for him. That treatment included a lot of lifestyle. So we had to reduce his chronic cardio, increase his resistance training. We came up with a custom supplement plan, so biomarker-driven supplements and also genetics-driven supplements. And then he wanted to do everything. So he was close to an OsteoStrong. So he went to OsteoStrong weekly, and he had a Merodyne, a whole body vibration plate. And then we optimized his hormones. We did not have to replace his hormones because they were not low enough, but we needed to nudge him up a little bit. And then he was also really interested in doing peptides. So we did peptides like AOD9604. We used oxytocin, which is a hormone. We used another peptide, CJC ipamorelin. All of these things, clearly none of these things are FDA approved for osteoporosis, by the way. But all of these things are for the big picture of health optimization. So let me get into these results, because it's actually really exciting. So what you can see is that he had REMS studies. And what's fun about REMS is that the REMS report will show you both a T-score and it will show you a fragility score. And so I only have the T-score side on here so we can keep this short. But you can see that his T-score was negative 2.6 in his spine and negative 2.7 in his hip. This is his left hip. His right hip was very similar. I won't get into the fracture risk assessment part since I don't have the other side of these slides. But this was his starting point. Now, his DEXA was actually a little bit worse than this, but it's nice to see that he both had reasonable bone quality and his T-score wasn't as bad on REMS as it is here. So here's him at 6 months. So I'll go back. So T-score of negative 2.6 in the spine, T-score negative 2.4 in the spine, 6 months later. Now, 6 months is a very short time frame to see improvement on any imaging. So this was actually really surprising. All right. So then his hip went from negative 2.7 again to negative 2.4. In 6 months, that's pretty remarkable. All right. And so he asked me if he could do a REMS at 6 months. And I said, honestly, I wouldn't, because I don't think that you're going to see improvement, and you might actually see things worsening before you see them get better. But he did it anyway. All right, so then if we go to 12 months, it continues to get better. So T-score only a little bit better in his spine, negative 2.4 to negative 2.3, but his hip continued to get better, went to negative 2.2. So you do the math on that, on the BMD, grams per centimeter squared, and he had 11% increase in his hip BMD. That's awesome. That's massive, right? And 4% increase in his spine. Now, he and I have been talking about his spine. He was a little bit depressed about that. And I did some research on this. I talked to our PhD in exercise physiology, Dr. Truby, about this, because we've kind of seen this consistently with our approach, that the hips are just like blowing it out of the water. And the spine is slower. And I think the reason why is because we are so good at giving the body what it needs with the programs that we're doing. We're giving the body all the building blocks. We're correcting, hopefully, all the causes of bone loss. And then what we're doing is loading the lower body. And people are lifting heavy and they're loading their femoral neck. And this guy was doing OsteoStrong, which is great. But it's harder to load the spine. And so I think what we're seeing is just the trajectory for spine is just slower. So, this is 12 months. I mean, most studies on drugs to show this kind of improvement, 11% you don't see, but 4% you would see, maybe at a year, more like 2 years, more like 3 years. So I'm super happy with this. Now, if you want to talk about fracture risk assessment, this is actually pretty fun too. So we calculate fracs, and you could argue whether or not it's amazing or terrible, but for the most part, I like looking at the hip fracture risk. So you can see when he started, his risk of hip fracture for the next 10 years was 5.9%. It's not that high, but he wanted to treat it, and he wanted to treat it aggressively, so we did. At 6 months, you can see that according to fracs, that risk was cut in half. Cool. And then at 12 months, it was cut in half again. Not quite. But overall, it's a 60% reduction in hip fracture risk and a 39% reduction in major fracture risk. That's pretty cool. So he's super happy. I'm super happy. He is on his way, and we have made some continued changes in his program. He's going to continue to see improvements. And the reason why I wanted to present this framework is because I see people get lost in the mess of all the different recommendations. It takes a clear focus. It takes a clear direction. And this is a simple framework that you can at least say, do I know why I'm losing bone? Am I doing something about that? When am I going to retest, right? And if you can do those three things, then you can walk out on the other side of whatever that time frame is, and you can reassess and say, okay, well, what's next, right? And so many of these things you can do by yourself. So if you haven't already, please click the subscribe button. I really appreciate that. Share this with anybody that needs it. 2 things that you can do to help get you on your way. So one is to download my ebook. If you look in the description below, click the link and you can download the free ebook. You can also go on Amazon and buy it. It's inexpensive. It's a short read. It is a jumping off point for what to do if you have a diagnosis of osteoporosis and you're not making forward progress. The other thing you can do is you can sign up to talk to one of our team members. We have both our full service program, which is what Tom was doing, which is awesome, but we also have self-directed programs. So we will talk you through how to do this on your own. Some people just need a little bit more. I think it's really hard to do on your own. That's why we created it. So I hope you find what you need, and I look forward to seeing you on the next video.